Wondering what to expect when you get your tooth pulled at the dentist and how to prepare for that tooth extraction appointment? Let's talk. Hi everyone, my name is Whitney and today I'll share an overview of what to expect when you get your tooth removed at the dentist, along with some insider tips to make your experience as smooth as possible. I am a dental hygienist now, but I used to be a dental assistant, so I've assisted with many extractions, and here's what I recommend. Number one, ask your dentist what to expect. I know it sounds so simple, but truly every extraction is a bit different. A single tooth extraction differs from multiple teeth being removed, so always ask. And wisdom teeth specifically have their own unique process. I'll link my wisdom teeth videos below for more information, but for the purpose of this video, most family dentists perform extractions, but if a surgical approach is needed, like cutting into gum tissue, you might be referred to an oral surgeon. Either way, what you want to do beforehand is, number one, discuss allergies. Inform your dentist or oral surgeon about any allergies, especially if you're allergic to any medications like penicillin, just in case they need to prescribe an antibiotic afterward. And also, if you're allergic to any numbing anesthetics, you'll get numb before they pull that tooth out, of course. Often they'll use lidocaine or articaine and a topical anesthetic as well. Prior to the shock, they will put the gel on your tissue so you won't feel the pinch, and they usually use benzocaine. So yes, first things first, you're gonna be numb. No worries about that. But if you're feeling extra nervous, number two, ask about sedation options. Ask about laughing gas, also called nitrous oxide, to help you relax if you're anxious or nervous about the appointment. This can really help take the edge off. It's similar to having a glass of wine or a margarita. It just relaxes you. Highly recommended if you struggle with any dental fears. And if you have extreme dental anxiety, ask your dentist about other options like twilight sedation or oral medications. But remember, you'll need a driver if you do anything more than just the laughing gas. Number three, payment and follow-up scheduling. Again, if you're anxious, consider paying beforehand, before they walk you back to the clinical room, and also schedule any follow-up appointments necessary before the procedure starts. This way you can leave right after. If that's an option, I've found it makes patients happy to be able to just walk right out when they're done, walk right out to their car, not needing to stop at the front desk. Everyone is different, but just consider this as an option. Tell them that you're nervous and ask if you can pay and schedule follow-up appointments beforehand. Now, some pre-appointment tips. You want to eat before your appointment. You'll be numb after, which makes eating tricky without accidentally biting your cheek or tongue. I've seen some serious bite damage. You don't realize how hard you're biting when you're numb, so definitely eat beforehand if you can. The numbness varies on how long it will last. Will link my videos below if you want to learn more about ways to make the numbness go away faster when you're done. But honestly, I say stay numb as long as you can, because then you'll have those extra hours of not feeling your extraction site, right? And prepare soft foods. So you want to go to the store beforehand and stock up on easy to eat, nutritious foods like applesauce, soup, mashed potatoes, things like that. You still usually don't want to eat anything too hard or too crunchy for a while, even after the numbness wears off. And we'll talk more about post-op instructions in just a sec, but first, let's talk about what to expect during the appointment. How long will it take? Extractions can be fast. The numbing part often takes the longest, but once you're numb, a tooth can come out very quickly. However, of course, sometimes it may take longer. Usually, again, if it's a surgical removal with bone and gum tissue to consider removing along with the tooth, it just depends. If you want to know how long your appointment is going to take, always ask prior to your appointment how long they expect it to be for your individual tooth or teeth. They will have a pretty good estimate since they are scheduling you for a certain amount of time. Just ask how long you're scheduled for. Next, don't be afraid to request comfort items, such as lip balm or Vaseline to prevent chapped lips. If you know, you know. Don't show up to the dentist with dry lips. This goes for any dental appointment, honestly. It's just gonna be uncomfortable after, because with your mouth open, your lip's gonna get drier and drier. And if you forgot to put chapstick on prior, no worries. Just ask, they will have something for you. Also, if you have jaw issues or you're worried about keeping your jaw open, ask for something called a bite block. If they didn't already put it in your mouth, it's so much better than trying to keep your mouth open. You just rest your jaw on it. It can prevent you from so much unnecessary jaw pain afterwards. Same with your neck and your back. If you're uncomfortable in the chair, ask for a pillow or a blanket if you're cold. We want to make sure you're comfortable. No request is too much. If we have it, we'll provide you with it. And then once you're numb, what to expect is really just pressure. You will feel pressure, but you won't feel anything more than that. It shouldn't not be painful at all. It will just feel like someone is pushing on your gums with their finger. If you feel anything more than that, let them know right away so they can give you more numbing anesthetic. And lastly, post-extraction care tips. Number 1, avoid straws and smoking for at least 24 hours. These can lead to a dry socket, which is painful and delays healing. I will link my video about dry sockets if you want to learn more, but for the purpose of this video, just know you want to do everything to prevent a dry socket. Number 2, follow your dentist's instructions. Some bleeding is normal, but follow any diet or specific care instructions closely. Again, this is a generalized video, not to replace your individual dentist's instructions for your individual mouth. Number 3, gently rinse if needed. You want to avoid vigorous swishing for the first 24 hours. We tell our patients to swish with their head instead of their cheeks, so you want to do this and not this. Number 4, take it easy. An elevated heart rate can cause increased bleeding and discomfort, so it's usually recommended to skip the gym for the first 24 to 48 hours. Always ask your dentist when it's safe to go back to normal workouts and exercise routines for your individual situation. And lastly, number 5, apply cold for swelling. Use a cold cloth or an ice pack if you have swelling, and always call your dentist if it persists for longer than they expected. So overall, if you've been putting off scheduling a tooth extraction due to cost, consider dental discount plans. I have a video on this, which I'll of course link below as well. These plans can be a great alternative to traditional dental insurance for some people, getting you the care that you need when you need it. I know many people who have used these plans and they've found them helpful for covering dental care costs. I even know some people who choose these plans over employer provided insurance because they make more financial sense for their individual situations. So check them out if you're interested. All the information is in the description box below. And overall, again, try your best to never put off any dental work for too long. Things only get worse over time. Catching things when they are small is always the best and most affordable option. And I hope this video helped you. Good luck with your appointment. If you've been needing to get a tooth pulled, remember that it will be so worth it once you finally get it pulled. And if you want to learn more about tooth replacement options, I'll also link that video mine below. And if you want even more teeth talk, of course, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.